welcome to another Tuesdays with the Disability Policy for All. Today I have the great fortune to be talking to Congressman Joe Kennedy from Massachusetts about a new bill that he and Senator Warren sponsored. So welcome, Congressman.
Thank you so much for having me, Liz. Thrilled.
I understand that you and Senator Warren sponsored the Behavioral Health Coverage Transparency Act. Can you explain to the audience what it is and what it will help with?
Absolutely, Liz. It's a critical piece of legislation to try to ensure that more people get access to the mental and behavioral health care that they need. One of the challenges that we've seen in our mental and behavioral health care system is that one of the primary laws to ensure people get access to the care, mental health parity, doesn't nearly have or isn't just forced nearly as strongly as it should be. So while there's laws and protections already on the books, particularly for private insurance companies, to ensure that they are providing access to care, that oftentimes many of them aren't, and most people don't know it, and they certainly don't know how to navigate through that process when it comes time to get that care. And so what this bill does is tries to strengthen the enforcement behind mental health parity, shines a spotlight on plans where they fall short, that aren't in compliance with the law, and then empowers consumers to be able to make an educated decision about what plans actually do and how the challenges they might have in terms of getting access to care that they need when they need it. And it's a critical piece of policy in order to try to address this gaping hole in coverage that we see.
I'm not sure that our audience will understand what critical means.
Which means?
Critical.
Critical?
Yeah.
The necessary care that people need when they're struggling with some form of mental or behavioral illness. Just when if you were to be injured in a car accident, or you were to fall down a flight of stairs and you needed to get access to care in an urgent circumstance, that care would be critical. And then in terms of mental and behavioral health care, look, more than 20% of our nation at some point, 20% of all adults at some point will wrestle with mental and behavioral health challenges. Yet the vast majority of adults on any given night, over half, don't get access to the care that they need when they need it, and it's worse for kids.
I'm not sure our audience will understand parity.
Parity is a great question, Liz. Parity is a complicated term that basically just means equal. So when we talk about mental health parity, it just means that mental health care will be treated the same way that physical health care is across our country. So if you were to break a bone, or break a leg, or need treatment for cancer, that our system says, of course, we'll treat you, we'll make sure you get access to the care that you need when you need it. We don't see that when it comes to mental and behavioral health care. It's much harder for folks to get access to the care that they need when they need it. And mental health parity tries to say, hey, we should treat both mental health care and physical health care equally. And if we're gonna do that, it means we have to do a major investment and advancement in the way that our country addresses mental and behavioral health care needs.
Okay, thank you. Okay, thank you and have a nice day. And thanks again.
Thank you so much, Liz.
Bye.
My honor.